Hi, I'm Anita, and this is Care Experts, brought to you by CareCredit. The CareCredit credit card can help you get the look you've always wanted now. CareCredit is accepted at hundreds of thousands of locations nationwide for things like cosmetic surgery, injectables, and other beauty procedures. Today, we're in Los Angeles, California with Dr. Feras Yamin. Dr. Yamin is a licensed plastic surgeon in Beverly Hills. Dr. Yamin specializes in rhinoplasty, facial aesthetics, and body procedures. So, Dr. Yamin, today we're talking about tummy tucks. Now, can you explain to me what exactly is a tummy tuck?
Tummy tuck, or the name for it is abdominoplasty, is basically you're trying to get rid of any excess skin or redundant skin and tissue from the lower abdomen and trying to shape the abdomen.
So tell me what the difference between a full tummy tuck is and a mini tummy tuck.
So if your excess skin or redundant skin that you have is limited to your lower abdomen, meaning below your belly button down to your pubis area.
Okay.
So then you don't need a full tummy tuck, you need only a mini tummy tuck, which means the size of the scar will be, instead of going from hip bone to hip bone, it's going to be much limited to the center. However, you are not changing the upper abdominal shape, and you're not changing your belly button shape or location by that. You're just addressing the lower abdomen. And most of these patients, they don't have that much fat pockets anyway, and usually they don't have a diastasis. So we are only addressing the lower abdomen. Usually, when I do it, usually they are male patients.
Okay.
Male patients, they don't have diastasis. They just want to address a little bit of the fat pockets on the side. You don't want to create an hourglass appearance in a male. The male, the masculine shape, it's a V-shaped masculine shape. So with the mini tummy tuck for a male patient, usually can do the job for them.
So going off what you were just saying, how would you assess or help a patient decide between a mini tummy tuck and a full tummy tuck?
So if my patient has all the above, meaning a lot of fat pockets, diastasis, a lot of redundant skin, excess skin, if the distance from their belly button to the pubis area is very limited, meaning their belly button is not, there's no much room, it's not high enough, you cannot do a mini tummy tuck, because this way you are only stretching, you can lower down the belly button, you're not going to get an aesthetically good looking result.
What is the recovery timeline after a tummy tuck?
So it is one of the procedures that I prepare my patients for it. It has a little bit the longest recovery because I do tighten the muscles, because I do shape the body. So there will be no heavy activities for at least 4 to 6 weeks sometimes, depending on the patient, depending on the size of the tummy tuck. We have an incision that we have to heal, and we have to maintain our application.
Now, is this procedure painful, and is there going to be any long-term scarring?
So the pain from the procedure, it is a little bit more of the painful side, because again, we are tightening these muscles. All this time, these muscles are relaxed, sitting on the side, they're doing nothing, and now we all of a sudden brought them back into the middle. It's almost like you just wake up and you have done 1,000 sit-ups all at once.
Oh, wow.
That's how it's going to feel. The scar, again, back to how meticulous you are in taking care of the edges of the skin, aligning them. 6 layers, 7 layers of closures, special kind of sutures. I remove the outer layers of sutures on different periods in the healing process, and address it with an aggressive scar management. And I also provide my patients with a lot of nutritional supplements, because if your nutritional baseline at its optimum, your healing is also at its optimum, your chances that the quality of the scar will be the best. And most of my patients, in about 4 to 6 months, most of their scars, the scar around the belly button, most of the time disappears. You cannot even tell. You have to really dig inside. And that's due to the special technique I do, the suturing from the inside. The scar down is going to be much lower than a C-section. I usually go very low below the bikini line, and I limit myself to the hip bone to hip bone for a main reason. If you were wearing whatever bikini you like to wear, I don't want my scar to show from the edges.
Thank you, Dr. Yamin. We'll be back with more Care Experts after this brief message.
Thanks to CareCredit, I can take care of my best friend.
Thanks to CareCredit, I can smile again.
Thanks to CareCredit, I can be confident.
Thanks to CareCredit, I can prepare for veterinary care.
I can take care of myself again.
I can be myself again.
I can plan for Cooper's care.
I can take care of my pug family.
I can
I can.
I can.
I can have peace of mind.
Welcome back to Care Experts. Let's continue our discussion on tummy tucks. What exactly is a tummy tuck revision, and why would someone need to have that?
If you're doing a revision within a short period of time from the original surgery, probably it was not done right the first time around. Either they did not remove all the excess skin, did not address some fat pockets, or they did not tighten the muscle correctly. Now, years later, if you get your tummy tuck, then you get 2-3 pregnancies after that. You get your weight gain, fluctuation. Then you're definitely going to stretch the muscles again. You're going to stretch the skin again, and you might get some extra fat pockets in areas that was not addressed in your index procedure. Then you might need to have a revision afterwards.
And how is a male tummy tuck different?
So again, that's addressing the shape, the contour, what you're trying to do. So a feminine shape for the trunk is an hourglass shape, while a masculine shape is usually a V shape.
Yeah.
So for the male, and most of the time males, they don't have the diastasis. Their muscle more or less sitting in the correct position, does not need to be brought back in. So that's remove the third part of the abdominoplasty, which is the application. And again, mostly also with the male, the fat is usually a little bit more solid, and the fat pockets are distributed mainly around the love handles and the lower part, rather than there's no upper back or bra roll area fat pockets. So that's the liposuction technique addressing that.
So what are the costs for various types of tummy tucks?
Well, depending on where you are and what type of practice you are getting your surgery at, in our practice in Beverly Hills, the ballpark for this procedure is around $20,000, but it can be variable in different places and different practices.
And what kind of financing options do you offer?
That's a good question. So not all of our patients come in financially prepared for the procedure. Most of our patients, they already have researched the procedure, they already have studied very well, and they have an idea about where it falls. They've been saving some money, and they're trying to come get the procedure. But more often than not, they are a little bit behind on the amount that's needed. Or sometimes when they come in, they do realize that actually what they were looking for is not that's only that involves other components in it. And here where comes the financing to help these patients. And I'm really thankful and happy that we actually have these options like CareCredit, for example, because here we can bridge that gap to these patients. And instead of telling them go back home and wait another 2 or 3 years and trying to save on that money, and you don't know with the economy and the market how it does, and maybe they won't be able to reach it. But with CareCredit, they can get their procedure right away, and then gradually they can pay it back.
Now, Dr. Yamin, I'm really curious. What would you say is your favorite part of your job?
Putting a smile on my patients. That when I feel my patients, they are very happy and satisfied. They feel comfortable and happy the way they look, the way they dress. That really makes my day.
That's so wonderful to hear. Well, thank you so much for joining us today, and you were very informative.
My pleasure.
Thanks for watching. All of our featured care experts accept and recommend the CareCredit credit card, which is accepted at hundreds of thousands of provider locations nationwide. Visit CareCredit.com for more information.
Thanks for joining us on Care Experts with CareCredit. If you enjoyed this episode, please subscribe and share with friends and family. And stay tuned for new episodes every week. Through October 31st, 2022, earn an entry for your chance to win $2,000 in the Let's Get Digital Sweepstakes. Enter the secret word MUSCLE in the Sweepstakes Hub to earn one entry now. Head over to the Sweepstakes Hub by simply visiting carecredit.com/Let's Get Digital. No purchase necessary. A purchase will not increase your chances of winning. Legal residents of the 50 United States and U.S. territories, including D.C., 18 years of age or older, who have a CareCredit credit card as of 9/6/2022. Void where prohibited. Promotion starts 9/7/2022 and ends 10/31/2022. Sweepstakes prizes are awarded in the form of a check. For official rules, including odds, free method of entry, and prize descriptions, visit carecredit.com/Let's Get Digital. Sponsor Synchrony Bank, 170 Election Road, Draper, Utah, 84020. Purchases with the CareCredit credit card are subject to credit approval. Minimum monthly payments required. See carecredit.com for details. This content is subject to change without notice and offered for informational use only. You are urged to consult with your individual medical providers with respect to the information presented. Synchrony and any of its affiliates, including CareCredit, collectively Synchrony, makes no representations or warranties regarding this content and accepts no liability for any loss or harm arising from the use of the information provided. Your participation in this presentation constitutes your acceptance of these terms and conditions.